Hi, everybody. This is Fran Horning, and I'm coming to you here from Dr. Grushinsky's Holistic Dental Center. And I want to welcome you to our second in a series of our wellness webinars. And the name of it, of course, is Why We Love Holistic Dentistry, and you should too. The reason being is holistic dentistry or holistic has become a buzzword as of late. And a lot of people are using it. They're using it. A lot of traditional dentists are using it. But what does holistic have to do with teeth? I mean, it's teeth, right? And, you know, holistic usually uses a lot of supplements and seeing other doctors. But more and more the traditional dentists are using those buzzwords, holistic dentistry or mercury free, and that they use purified water and BPA free. But does that really make them a truly holistic dentist? There's a lot of similarities between traditional dentistry and holistic dentistry, but there's a lot of differences, and those differences are going to surprise you in a pleasant way. So I want you to make sure that you find a truly holistic dentist, and we're going to talk about how they are similar and then they're different. But first, I want to introduce you to our panelists. And first, we're going to talk to Dr. Vladimir Grushinsky, who is not only an accredited member of the IAUMT, he's also SMART certified, which means that he has verified that he can safely remove mercury, which we'll talk about in a little bit. He's been practicing holistic dentistry for over 20 years, and he's going to be able to share with you why he believes and loves holistic dentistry and why he believes you should too. Next, we have Dr. Sawhney, who is a practicing holistic dentist who is also SMART certified. She has extensive knowledge in safe holistic dental procedures and protocols and is continuously expanding her knowledge on the safest holistic dental modalities. And then we also have Ella Grushinsky, RDA CNC, who maintains her licensure as a registered dental assistant and is a certified nutritional counselor and has over 20 years of experience in implementing her skills in a holistic dental environment. And lastly, me, your Fran, your holistic hygienist. I'm a practicing hygienist and speaker with 35 years of accrued knowledge in the traditional and holistic practices. So we want to be able to impart our knowledge and give you more information of why we love holistic dentistry. We want to be able to answer all of your questions, so we would invite you to submit questions while we're talking. You know, either it be on Facebook. You might see me looking at the Facebook page now and again. Submit your questions, but we're going to reserve time at the end to review them because we have a lot of information that we want to get through. So first, we're going to get right to the brass tacks. We're going to talk about traditional dentistry and holistic dentistry and how we are different. I'm going to talk to Dr. G first. Dr. G, do you give us a little history of what holistic dentistry is, how it started, when it started, and what it's all about?
Holistic dentistry started many years ago. You know, we're going to start counting 40 years ago, and this is three major organizations. Three major organizations who gathered together holistic dentists. First, it's International Academy of Oral Medicine and Toxicology. This organization established in 1983, and it's containing just more than 800 members. And idea to get this organization going, it was just find out what toxic, harmful material can be used in the patient mouth system during the treatment. And their motto basically show me the science. It's a very important organization in my mind. I'm a member of this organization, and I really love to go for those meetings. Another organization was established later on, 2 years later, and this is International Academy of Biological Dentistry and Medicine. And this organization is a biological group that really providing how to get together all these modalities of the dental treatment and how the health and disease developed, and so how the body functions and how the body self-heal. And this is organizations very, very important in my life too, because you know that the last few meetings, you know that both organizations had together. And last but not least, this is the first Holistic Dental Association established more than 40 years ago, and I was on the 40th year anniversary of this meeting of Holistic Dental Association. It was established the practitioners who just want to just learn new techniques, who make people healthier, and they want to just share this information with another dentist. And the most important thing, they want to learn and they want to share the knowledge. It looks like it's a lot of holistic dentists, 800, 200, 360 people, you know, that altogether you start to calculate 1,500 holistic dentists. But in reality, it's not entirely true, because I am a member of all of them, because I want to just learn and implement. And this is not the best way to learn. It's go with those meetings and talk to people you just there and implement and implement. And you know that holistic dentists very often go into all three meetings, become members of all three organizations. Basically, if I look at this, it's less than 1,000 holistic dentists. And the most important thing, the dentists not only learn and just listen to this something new, implement it. Because if you don't implement the knowledge, you cannot really help patients. And this is very, very important in my mind. What is implemented in the office? How much you can help the patient? What area of the holistic dentistry you know? You know that you may restrict yourself only just removing silver fillings, but you may just expand your knowledge a lot and really implement vast knowledge that you can learn on those meetings.
Wow. I mean, we haven't even gotten into the meat and potatoes of the webinar, and you've already explained a huge difference between a traditional office and holistic, that you actually made a conscious effort to study for, it sounds like, nearly 40 years. You know, even though holistic dentistry, a lot of people think that it's a new wave, a new thing, but actually it's been around for a little while. And you've made that conscious effort to obviously do no harm.
Most important thing in holistic dentistry is just put the person as a whole thing, and most important, do not harm, because it's a very well-known statement of the holistic dentists and the good doctors: do not harm. It's coming from a few thousand years ago. It's Hippocratic oath.
Exactly. It's obviously you're doing what you do because you care about taking care of people. It's not just their teeth, right? So yeah. This is a wonderful thing. So now what we're going to do is we're going to get into the meat and potatoes. What is the difference between a traditional office and a holistic office? And we're going to start off with Dr. Sarni. We're going to ask, what is the difference between mercury-free and mercury-safe? Is there really a difference?
Yes, there is actually a difference, and thanks for bringing that up, Fran. So when, there's a lot of offices that actually advertise and also talk about mercury-free, we're mercury-free, but nobody really talks about mercury-safe. There's a big difference between the two. When you say you're mercury-free, that just means you're using other products that don't have mercury in them, but what happens to the amalgam when you go to traditional offices? They just use a high vac suction, and that's all they use, and they get, the amalgams out. The most amount of vapor is actually eliminated when you remove it. And so it has to be done very safely when you go to an office. You have to know what is being done, and there's a very strict protocol. This strict protocol is not just to say, okay, it's a marketing gimmick and let's, get patients in. It actually, we've seen results. There's a whole protocol to make sure the patient is safe, the provider is safe, and the assistant is safe. Everybody in that space has to be safe, because the mercury that's released during amalgam removal is quite high. And so we have to make sure everybody in that area is safe, and not only during, but before, during, and after. There's a whole protocol that needs to be followed. Usually when protocols have come out, people will use the same protocol for a long time, and then the same protocol goes outdated. At our office, that's very different. Both Dr. G and myself and all the staff members, we always constantly are reaching to see what's new, what's out there, what's really going to help our patient, because not one patient is not the same. Not everybody is the same. Every individual is different, and how I may detox something may be different from somebody else and another person. So we have to be very safe how we remove this stuff, because people can really get sick from it. And so, it's not only important what materials we're placing, because we also need to make sure the materials we place are safe for you. So we have to make sure how we remove it before we even start removing. You're on a protocol while you remove it and after. And I stress on this thing again, this sentence, because it's very, very important. Everybody's immune system is at a different level. Everybody's body detoxes at a different, rate and different way. So we really need to, see how each patient is doing and then go from there.
I just need a little clarification. So if I go to a traditional office, can't they take out my mercury fillings? I mean, if a dentist knows how to pick up a drill, they can drill out my amalgams anywhere. So, right. So really, why, I hear you talking about detox and stuff, and, what does that mean? Like, is the mercury, like, so you guys are specially trained to be able to do that? Like, I don't understand. I can go to the guy across the street.
Right. So Dr. G and I are both SMART certified. What SMART certification means is we're trained in how mercury can be removed safely using a technique that's taught to both Dr. G and myself, and we know what we're supposed to use. There's different materials we use, different things we use to make sure this is safe both to you, to me, and to my assistant.
Okay.
And it's part of the IOMT.
Yeah. Also, I want to add it a little bit to what Dr. Sani said. That whatever we're using for the patient, we have to use a smart way, because, there are so many supplementation protocols available, and you have to really be on the top of what's going on now. What new materials available, what supplements available, how to use it right. And you have to just really update it, because knowledge changed and improved. And you might be sticking with something that was written 20 years ago. You have to really constantly update. And, just recently in our office protocol is updated. And it's might become more health-oriented, really protect the patient whatever everything needs. Because we started detoxification right away.
Okay, doctor, I'm going to ask you to clarify that to our listeners who may not necessarily know what that actually means. If somebody is exposed to mercury vapor who can't process it, like the body can't get rid of it, is that what you're talking about? We help them get rid of the exposure.
Yeah, because basically in order to eliminate the mercury, you have to make sure that kidney working properly, liver working properly. And the most important thing, whatever just eliminated by the liver, it's not going to be reabsorbed by the digestive system. You have to really look on everything. Yeah. You have to really make sure that patient is ready for this.
I see. Because I would think a lot of people say, well, my fillings don't bother me, my amalgams don't bother me, I've never had a problem before, but they may have problems that they may not even realize. So, once you start removing them, they potentially could have issues. So this is, it's good.
I'm sorry, friend. We have a lot of patients coming in and telling us that their silver filling was removed not properly, and they get sick after that.
See that? Okay.
It's very important to protect them before they get the problem.
Wonderful. So there you have it. Between a mercury-free and mercury-safe, there's a huge difference. Mercury-free means you don't use mercury, but are they removing it safely? All right? You can be removing it and putting in the free stuff, but are you being exposed to all that mercury? So here you have that next level of assurance that you're not being exposed to toxic materials. So thank you for clarifying that up. All right, so the next one is, I'm going to handle that, being the holistic hygienist, with conventional hygiene appointments and holistic hygiene appointment. A cleaning is a cleaning, isn't it? I'm just getting my teeth cleaned. It's just a cleaning. Sorry, words like that go through me like a knife. But in a traditional office, when we do cleanings, a lot of times we use very similar modalities. We use a machine that sprays a lot of water. and that water flushes away a lot of the bacteria and tartar and things like that. But what we do here is a little different. A lot of times when you have a cleaning in a traditional office, they're hooking up their machine to the city line water. Now, if anybody has used their city line when they filled up their kettle and they boiled the city line and they don't use the filtered water, they boil it and they can see in the bottom of their pot all this sediment and stuff. That's what's going to your body. It's arsenic and lead and all kinds of stuff that you don't even want to imagine. So that's all going through your mouth as they're cleaning their teeth. But what we do differently is we infuse our water with a supercharged oxygen called ozone. That ozone has that extra molecule of oxygen. So we are now not just cleaning your teeth with purified water that we have super filtrated. We're infusing it with extra supercharged oxygen. We all know oxygen is life. So all this oxygen, not only is it kill naturally bacteria and viruses and fungi and parasites. Yes, I said parasites, and we do see them almost on a daily basis. This supercharged oxygen is killing these pathogens that are causing your bad taste in your mouth and your bad breath and your gums are bleeding. So it's not just removing the tartar, it's infusing this life-giving oxygen into the gum tissue and making it much healthier than it was before you came in. Also, we are using a lot of herbal solutions. These herbal solutions have things that will help soothe your gums and help tone, help heal. So basically, when you have a regular cleaning in a traditional office, they're just removing the tartar, and they're using that scrapey thing, and then they polish your teeth with some paste. But what are they doing to really enhance your body's healing properties? I've been on both sides of the boat. That's why I'm so passionate and excited about what we do here, because I'm not just removing the tartar and the plaque, but I'm actually allowing your body to get that next level of health and health. So these things like calendula and black walnut, CoQ10, that are in our herbal solutions, we are flushing out that turtleneck of gum around each tooth and really infusing it with those healing supplements and herbs. Another thing we like to do is we polish your teeth with something that has no fluoride, no flavoring, no dyes, no chemicals, no nothing. If I just want to take the stain off your teeth and polish your teeth, why am I going to put all this toxic junk in your body? I just want to make your teeth clean. I don't want to give you a fancy, pretty green color or, pink bubblegum flavor. What's that do for you? It's not doing anything but putting junk into your body. So we don't use anything with fluoride. Our water is fluoride free. Our polishing paste is fluoride free. Any of the solutions we use is fluoride free. So we are very, very proactive in making sure that our patients are kept very healthy. I hope I cleared that up pretty clearly. So unless we have any comments from anybody, we can move on to our metal implants and zirconia implants.
Oh.
Any comments, Dr. G? Okay, looked like you wanted to say something there.
I'm so passionate about it, that they didn't change the slide before you finish.
Yeah, gotcha. That was me. That was my fault. Oh my goodness. All right. But yeah, so yeah, now we have implants. Now that's a new thing. Everybody, has a missing tooth. We know that if you have 6 or more missing teeth, it can shorten your lifespan by about 10 years. So people are looking to enhance their health with implants, but an implant's an implant, just like a cleaning is a cleaning, right? I can get an implant for $50 down the street. What's the difference between a metal implant and a zirconia implant? What's the value of me getting a high standard implant for a holistic office? Dr. G, can you answer that?
Sure, I can answer. Just look at one of these. It's metal. It's a gray. It's a shiny color on the top, but in reality, it's gray. The time passing by, and this is the gum going to recede it with age. It's going to show the gray color around the gums. Who want to see something gray in the mouth? Nobody want to see it. And if you look at this implant, it's ceramic. It's white. If something going to be receded, it's going to be white. It's not going to just show any difference. And you look at those two, and this is metallic implant, has electrical conductivity. Do we need another antenna in our jaw?
Okay.
That I don't know about it. This is
I think
metallic.
Lucille Bill said that she was able to get radio stations in her ear with her fillings. Maybe we can. No, I'm
It's
joking.
not a joke.
But it's truth. It's the truth.
It's not a joke. I had
Yeah.
a patient that she cannot function around radio, around the cell phone, around the computer before I completely remove all metal from her mouth.
Wow.
The serious stuff.
Wow.
I know that she was ready to rip all her teeth out, and I just remove her old crowns and pins. Amazing. Everything just metallic was removed, and she's just doing great. And this is metallic implant. It's a metal, you know that. And as we know that a lot of people have allergy to metal, we know statistically minimum 30% of female population in the United States allergic to nickel. And from the literature, we know that 4% of the population allergic to titanium. Higher or lower grade, but the allergy exists. And that's why I prefer in our practice to talk to the patient about zirconia. Yes, they're more sensitive. They need to more learning curve from the doctor. And this is understandable because this is a new modality. But in reality, it has no thermal conductivity. Basically, if you're drinking something hot in your mouth, it's going the temperature going through zirconia implant, nothing. From metallic implants is going to your jaw. And this is the interesting thing. It's a new technology, new learning, but what we're going to talk about from the holistic standpoint, because it's no electrical conductivity. It doesn't interfere with energy flow inside of your body. It doesn't interfere with meridians.
Which we'll touch on a little bit later on.
Later, definitely.
Okay.
All right.
So thank you, Dr. G. So now that clears that up of why there's such a benefit, a holistic office to offer the zirconia implants. Now, Dr. Son, this is the next topic. A crown is a crown, right? Just like a cleaning is a cleaning. A crown is a crown, a cap, whatever you want to call it, right? And I can go to the guy down the street, since I already went to the guy across the street for my cleaning, I can go to the guy down the street for my crown, right?
Right.
So what's the difference between a traditional office doing like a cap or a crown, with the metal in it, and say, in a holistic practice doing the non-metal crowns? What's the difference there? Like why should what should it matter to me?
Very good point, Fran. So I'm going to touch a bit on this. So, she's right. You can go anywhere across the road, down the street to get, a zirconia crown, sure. And, a lot of places still place the PFM, which is the metal crown. However, people don't know, what materials are in this crown. In the olden days, we used, guy down the street who was our lab person. We knew exactly what materials were being used, where they came from. Nowadays, to keep the cost down, a lot of people are sending the crowns out. Whether they send it to China, they send it, wherever they send it. We don't know what is in this materials. They don't send a certificate. There's nothing with it. Yes, it gets you a cheap deal and it gets you a crown for $100, but is that what you want in your mouth? As Dr. G mentioned earlier, 30% of the population is allergic to nickel. And now with all the different hypersensitivities that people are getting day in and day out to foods, to materials, to, aerosols, to everything, we want to know what is in our materials. We want to know where the crown came from, where it originates, so we know exactly that it's safe for the patient and it's non-toxic. The other thing is, a lot of patients don't realize when you remove an old crown, we don't know what's underneath there. We don't know whether it's amalgam again, whether it's some other material. We don't know. Most of the crowns, when we remove them, we have to remove them safely, but we have to remove the material underneath it safely also. And once we remove it, we also go into, as I said earlier, people are so allergic to different materials, and people whose immune systems are already lowered by other diseases or whatever else, if they're going through anything. If you put a material that they're not suitable to in their mouth, they're going to have all kinds of sensitivity issues. It may even make whatever their condition is worse. So at this point, they're not going to say, oh, the dentist did something wrong, but we've seen case in and case out of some people that materials actually they're sensitive to. In fact, we had a young gentleman, no names obviously, but we had a young gentleman who came in and he said, I've had this, scratch in my throat for months and months since the dentist put this crown with metal in it. And we did something as simple as took the crown off and put, a zirconia crown and remove the material safely that was underneath, and had him do a biocompatibility test to make sure he was safe with all the materials. And we only used materials, customized the materials to him with his biocompatibility test. And then the guy came back and said, hey, I actually feel better. So these are the stories we're looking for. This is what we want. We want to help people get better in whatever we can do to help them, and also use materials that are safe for them. And every material that is used in our office, we check, we make sure that it's BPA free, it's BIS-GMA free, it has no fluoride. So we're actually checking through everything from the fillings to the bonding to the etched, whatever we're using. Everything is being checked by us personally to make sure we can give you the best or the least toxic thing we can give that's available on the market.
It's amazing. I'm sitting here, even though I know this information, but you're telling me how this guy was actually having symptoms. Who would think that having a dental work would cause you to have another physical symptom because of an allergy or sensitivity? I mean, there's a disconnect. Like, here's my mouth, here's my body. The two have nothing to do with each other. And, we are allergic. A lot of people are allergic to foods or allergic to environmental issues. Why can't they have a sensitivity allergic to dental material? So that's what the big, huge crux of the difference is with the holistic office, is that we pay attention to the details like that. You go to a traditional office, they may not, say, oh, the patient's crazy. There's nothing wrong with that gap. It looks fine. Even though the patient has red, bloody gums and they have a scratchy throat, it's amazing the difference that having dental work that's compatible to your body can make in your health and your lifestyle and the quality of your life. It's amazing. So thank you, Doctor.
I'm going to just give you another example, friend. Dr. Sani mentioned about zirconia crown, but sometimes they are not good too. A few months ago, a patient who was so allergic that we found out she's not good for zirconia crown. We have to order a very special crown for the very special lab.
Wow.
Because she cannot even handle, the zirconia crown.
It's amazing.
It sometimes happens, and if you're going to miss it, she's going to be in big trouble.
See, the thing is, in paying attention to the details, that's what I find so amazing, and why I love holistic dentistry so much, because paying attention to the details really makes a difference in a patient's life and the quality of life. Because, like I said, I go to the guy down the street, puts a cap in my mouth, and then I've always had problems ever since the cap, and I keep saying there's something wrong, and I've made 10 visits to the office, and they keep saying it's fine, there's nothing wrong, and now I am classified as a difficult patient. A note is put on oh, she's a difficult patient. But it's not. They actually have a real problem. And
also,
that's what
Fran, the other thing I wanted to mention also, which, in our office, we actually all took phlebotomy training, 7 of us. And, with the phlebotomy training, we can do the biocompatibility testing, because you have to go to a lab and draw blood. We do it right here.
Oh,
We're
fantastic.
Certified, and it's 7 of us. We can take the test right here, send it to the lab. We get the results in 3-4 days from the lab. It's amazing. It's just really, really amazing what we can do here for everybody.
That's fantastic. Because if I can find out that easily whether I'm going to have a reaction, like, for example, I'm going to just use a personal example. My son has a lot of anaphylactic allergies to foods, and there's a lot of things that he's very sensitive to. I mean, even when I do the cleaning for him, he asks me not to use certain things because he's so sensitive. So having this capability that he can have the biocompatibility, thank gosh he has not had any cavities that we need to talk about. He's had one little tiny one, and that's without fluoride, everybody. the fact that he can now have this biocompatibility testing so that he can, in good conscience, and sit in the chair and not have to worry about whether he's going to have an issue. So people like him can really feel safe to know that, you know, they're not going to have any reactions to anything that we do here. So that's a very good point. Thank you, doctor, for bringing that up. So any other comments? Any more input on that topic? I think that's you got any, Dr. G?
Yeah, you know, because it's very, very important part of our practice to be personalized, because this is the person sitting in front of you. It's not the tooth. It's a person in front of us. You know that a few days ago, we just spent enormous amount of time just talk to the patient because she was so scared to just sit in the chair. And she needed the procedure. She came and she requested procedure done, but she was so terrified. We have to have a time and ability and a lot of love towards the person to just talk to her, just help her, use homeopathic remedy, and just a lot of things going on. And you're going to talk about this help.
Yeah, and that's why I was just about to thank you for segueing me into the next topic. That was perfect, Dr. G. We didn't even plan that, everybody. That was just kudos to you, Dr. G. So yeah, my next topic is going to be actually about dental anxiety and traditional sedation and natural anxiety relief. The reason why we want to talk about that is because it's unfortunate that there's such a large percentage of the population that have a fear of the dentist. You know, there's a lot of comics about it. There's a lot of jokes made out about it. There's a lot of, you know, people make fun of the dentist. You know, they make us so cartoonish, like, oh, all these horrible people. And, you know, I want a long, slow root canal, and, you know, wacky horror. But we have modalities now that we can actually help a lot of patients. And, you know, I don't know about you, but I've heard a lot of people talk about, you know, I'd love to go to the dentist, but I can't stand needles like that. And even have the sedation in an office where they give you the IV. It can be very, very, you know, anxiety producing in and of itself, never mind going to the dentist. So I'm anxious about getting the sedation because then I'm going to feel cruddy afterwards. I'm going to feel dizzy. I'm going to feel logy. I'm not going to be able to drive. I'm going to feel disoriented. I'm going to need somebody to drive me. I'm going to feel out of it. I'm not going to, you know, I don't want to feel like that. It's very uncomfortable. So I don't want to have any kind of heavy sedation. I want to be in control. I want to know, you know, I want to be able to turn and be able to swallow and such. So, you know, for some people, if that's the route they want to choose, that's fine. It's available. But we choose to be able to treat people in a more natural way. There's things, a lot of pharmaceuticals that people can take, even gas. People know have heard of laughing gas. Some offices use still, you know, the laughing gas, but still that can make you feel a little fuzzy, and you need to sit on oxygen for a while before you can drive. And, you know, again, you're putting a toxic gas into your body. So if you have a choice, if you had your druthers, as my mother would say, you know, if we have a way of making you very comfortable, making that anxiety go down in a very natural way that is not going to affect your cognitive abilities, it's not going to affect your driving abilities, it's not going to affect your communication skills, it's not going to make you feel logy and goofy for the rest of the day, and I have to go home and I have to sleep for the rest of the night. I'm just so shot. It's going to really be a benefit. So that's why we like to offer that. So we do offer things like homeopathy, like Dr. G said. For homeopathy, for those who don't know, is an energy medicine. It's a couple of 100 years old, where we use these homeopathic remedies, place them under the tongue, and then within minutes, you can see the patients will just start to calm down a little bit. They don't feel as antsy and anxious. So it takes the edge off, and they can communicate, and they feel very, very comfortable. For those who need a little more of a boost to reduce that anxiety and fear of the dentistry, we can use something that is, it's called Nucom. It basically is using something that our body already produces. You know when you're in bed and you're just ready to go to sleep and you're starting to feel that little drift off? That's your body producing GABA. GABA is obviously naturally producing, and they were able to extract GABA from another source. And they put it in a substance, whether it be a pill or a cream or whatever, and we introduce it into the patient. Put it on their carotid, or they chew up a tablet. So they're getting a little extra GABA, so they're starting to feel that nice relaxed feeling. And then we put some electrodes on the sides here, and that just helps stimulate the GABA to get into the bloodstream. And what the really nicest part of it, you can see these headphones that this young lady is wearing, and these headphones have beautiful classical music, or new age, new wave music in them, and it has waves that are impregnated in that, and those waves stop your brain waves from being all like scattered and excited to now being very low and calm. So between having that calm sensation of the GABA, making you feel a little relaxed, and those brainwave sounds that are in the background, just calming the brain, you can relax. You feel like you're floating. You can still hear the practitioner. You can still relax. You can enjoy the music and not even realize that the time has disappeared. I mean, we can have a patient in the chair for an hour for their cleaning, or an hour and a half for a procedure, and they feel like they were only here for 10 minutes. I had a patient once, I'm sorry, I have to share this one. Big guy, huge, big rough guy, and he was just, he said, oh, I hate having my teeth cleaned. And I'm like, you know what, do you want me to try this new calm? And he goes, you know what, yeah, let's give it a shot, because I told him that you can drive, because he had his suits on, he was going to work right afterwards. So I put it on, and he's, relaxed. He had his eyes closed through the whole cleaning. He was able to do it, and when it was finished, I was able to take off the headphones and everything. And I said, well, how was it? And he goes, oh my God, that was fantastic. That was better than any Dead concert I went to. And we were hysterical because he was so relaxed that he actually enjoyed having his teeth cleaned, because that anxiety was gone. So we have these modalities where he's able to drive to work. He had his suit on. He had meetings all day. And it was the great thing about it. And you have that nice after effect. You have a nice zen, calm feeling for the rest of the day. Not that you feel loopy or goofy. It just makes you feel very calm. And nothing's really going to rattle your feathers for the rest of the day. So there's an added benefit. You're going to be nice and chill that day. So it's really a great benefits that we have here using NuCalm and homeopathic remedies. And Ella or Dr. G, Dr. Soni, do you have anything to add? Because I know you guys have been using it. I know Ella with the homeopathy, and Dr. Soni and Dr. G, you've been using NuCalm a lot with the patients.
Yeah, no, I love it on all the kids we get, and adults as well. I mean, I do treat a lot of the patients who are very, very scared, whether it be children or adults. And, I did not train in homeopathy prior to joining Dr. G, but once I joined him, I took a course. And at first I was very skeptical. I'm like, does this stuff really work? I mean, I'm trained traditional dentist, and so I was questioning it. And I was like, I don't think this stuff works. I read articles and articles. Then I said, you know what? There's no harm. If they're saying it's placebo, let's try it. So then I started trying it on my patients, and it has converted me completely that some of the stuff really actually works. From a guy who I had that had some nerve damage after an extraction, where regular oral surgeons and pain management people had said, oh, we can't heal this guy. I said, look, let's try this. It's not going to harm you. Let's try some homeopathy. Let's see what we can get. And believe it or not, we got most of his feeling, like of that sensation, back. That for me was like, oh, something works here. So then I tried it on another patient and on another patient. And also kids, as you know, kids are very, very active. They want to jump around in the chair. Some of them are anxious. Some of them are really scared. And it's hard
to get a placebo effect on the kids too. I mean,
exactly.
It's real. I mean, nope, that doesn't work. No, they'll tell you.
And we give them, half an hour before they come to their appointment. and they sit down for me. And some of these kids have had horrible experiences elsewhere. And for us, you know, the homeopathy works like magic. I'm like, what's in this stuff? You know, so
It's real.
The magic stuff.
exactly. So it really works. And also for very, very anxious patients, why put them through sedation? We don't know how everybody's body works, how complicated people's allergies are, what drugs they're on. Even though we know what drugs there are, we may not know the real interaction happening in their body with these drugs. So why use that when we can get a similar effect with something that's not poisonous for them, that
Exactly.
we know is not going to cause them harm?
And if
And about new calm, I want to add that, you know, that I'm going to tell you what happened to this. I ordered new calm because, you know, that they recommended to me. I brought it home. I put on myself. And where those hour and a half gone, I don't know.
it was wonderful.
And
Wonderful.
you know, since that, it's used for many years in the practice.
Exactly. And what's more important is recently, I'm sure you've been following in the news, that unfortunately you're reading more and more often where these little children are going to dentists and they're getting put to sleep and they're dying because they're not reacting well to the sedation. When I don't know that, I don't want to get into any kind of litigious discussion here about it, but you know, these kids, whether they are the MTHR mutation or, you know, too much sedation with the age, or who knows what it is, but it's happening more and more. So why put yourself in a position where that, you know, taking a risk? So we have risk-free modalities that can really help make you anxiety-free without having to worry about, am I going to have a bad side effect? Am I going to be able to, you know, am I going to wake up from this? Am I going to be able to drive home? So that's why it really means a lot to all of us that we were able to offer this. So I'm sorry, Ella, did you want to say something? Did I cut you off?
No, everybody
Okay.
pretty much said already what I wanted to add.
Okay.
So we're all, you know, passionate about, you know, our, you know, procedures that we do in the office, and I'm sure, you know, people understand, you know, why, you know, we're talking about, you know, all this stuff, you know, so much, because, you know, that's really important, you know, for us.
Exactly. And while I have your ear, I would like you to talk to us a little bit about X-rays and X-rays in a traditional office and X-rays here. X-rays and X-rays, just like I said before, it's all the same, right? But, you know, why don't you talk a little bit about what makes us different as far as the X-rays?
Thank you, Fran. Actually, you know, this topic, you know, this is, you know, very well-known dilemma, you know, for everybody. When people go, you know, to the dental office, you know, they always concerned about, you know, taking X-rays. And are the X-rays safe? Are we using, you know, extra precautions, you know, for that or not? This is also always a question in the patient's mind. And a lot of them express those concerns, you know, during their visits. And some of them are opting out, you know, from the X-rays because they don't want to be exposed, you know, to, in their opinion, unnecessary radiation. And, you know, we agree, you know, with them. So, you know, we take, you know, X-rays here minimally, you know, when, you know, we need to take them. But in reality, you know, unfortunately, the X-rays are still, you know, diagnostic tools, you know, and, you know, we have to have the X-rays, you know, when we treat the patients. And if, you know, patients opt out, you know, for it, then we kind of facing other issues, you know, like undetected decays, you know, or underlying conditions that might be missed. And then, you know, it might be a problem in the future, you know, for the patient. So, you know, we still do have to take X-rays no matter what. And obviously, you might say that, as, you know, the rest of the dental practices, you know, we do take X-rays, and our X-rays are digital. But you might say that, you know, the dentist next door also, you know, have a digital X-ray. Yes, you know, this is true. But, you know, in addition, you know, to having the low radiation X-rays, you know, we're using other extra precautions. For example, every office that using the X-rays have to have, you know, special protective or I would say special ring holder that holds, you know, X-rays and helps us to take the X-ray and get it close to the tube. So we use special rings that call DexView. Why this X-ray holder is different? Because this holder has tungsten core, and is able to block unnecessary radiation and reduce it 30%. And even though it's reducing the radiation 30%, it doesn't affect the image quality, which is a wonderful thing. In addition to that, we, as you already heard, we're really big on supplements. So, we offering to our patients to take very strong antioxidant right after, they take, X-ray. And it helps them, to reduce the possible harmful effects, of radiation even more. In reality, the amount of radiation that our patients get, during the X-ray exposure is actually, 20%, 20 times less, than getting the radiation from the drinking water. Some people will be surprised. Yeah, nobody is thinking about it, but in reality, that's what it is.
And I might have to throw my water out.
Well, you're not, I hope you're not drinking tap water.
No,
right?
I'm drinking the filtered water.
Okay.
Yeah, that's true. A lot of times, you hear it, from dental professionals that, you're taking full set of X-rays. It's like, spending 15 minutes on the sun. Yes, we don't want to take, extra to get exposed to extra radiations. But, if this is something really important, for your health, or, for your, overall health, when it comes to the teeth, then we do have to do, some X-rays. We also, use, a lot of, 3D imaging, cone beam X-rays, which also comparable to that, and it's also minimizes the amount of exposure, radiation exposure for the patients. And we're extremely excited now with the fact that we introducing at the office a new diagnostic tool that calls CareView. It's an intraoral camera. It's pretty much have the same look. And it does almost the same thing. It has the same but very, very strong white light. It's much stronger than regular intraoral camera. This light helps us to see the beginning of the cavities, because it shines through the tooth and shows all cracks, and shows the cavities at the early stages. It's gonna help us definitely to detect the caries at the early stage. But the most importantly, it's going to make our kids more comfortable, because in reality, a lot of times we have kids in practice, and when they come very little, and we see even visually that they do have a decay, but we need to see how big and how deep those decays are. We're not able to take X-rays on them, because they still the sensors are big for the kid's mouth. No matter what they're saying that this is the pedo sensor, they're still bulky, and they're still big, and they're still uncomfortable for kids. And again, a lot of parents expresses their concern that they don't want to expose their kids, especially at the early age, to the radiation. So this tool is going to help us to detect the cavities in the very, very beginning stage, and help us to treat our children and make them more comfortable. And this is very important thing for us, because in reality, we are for extra precautions. We are doing everything to help our patients to feel safe here, not just comfortable. We want to make sure that our patients feel safe in terms of getting any procedures done, in terms of getting any materials that we put in their mouth, in terms of equipment that we use here. We want them to understand the difference between materials and equipment that is going to be used down the road versus to what we can use here.
Wonderful.
Thank you.
Thank you.
Yeah, because without this technology, How are we going to be able to see anything on the kids? Or what about that patient who refuses X-rays every time? So now we have that next level of ability to help more people get healthy.
Yeah,
So
and
that
in reality, we do see a lot of kids in our practice. And, when parents come, they're really, really concerned about the fact that, they, as a part of the diagnosis, you have to have X-rays. And they're really concerned about the fact that, as a part of the treatment, you have to put kids to sleep. And this is a really big issue, in our office. And, we try our hardest, to, make them comfortable, without, going into, such a harmful stuff.
Yeah, and it sounds like we have all the answers between the Carry View and the homeopathy or the Newcom and all these things. So if you're going down the list and comparing, traditional dentistry versus holistic dentistry, you can see the similarities, but you can see we take that next level of care to really try to take the best care of our patients because we choose to do no harm. Now, as promised, I was going to ask Dr. G just to touch on the meridian chart just a little bit. So if you have a couple of minutes, Dr. G, can you talk to us exactly what that means? But I'm coming to you for my teeth. What's that got to do with my teeth?
That I'm going to start a little bit different of the direct answer. I'm going to talk about acupuncture. Acupuncture not been well known in the United States for a very long time. It was developed in China 5,000 years ago, and basically it's become well known like 50 years ago. Then Henry Kissinger went to China because they just developed a relation with China, and one of the people in his team get in the hospital and they get operation and they used acupuncture for him, and he happened to be just writing for New York Times. They put an article about acupuncture. And before was just few acupuncturists from China in California, and after that acupuncture is just widespread in the United States. Now almost every hospital has acupuncture and everybody knows. And how this acupuncture works? Energy flow. They put in the needle in a certain area in your fingers or the feet or the ears and heal internal organs. But 5,000 years ago, the Chinese developed acupuncture. They knew 5,000 years ago that every tooth connected to certain organs, to the muscles, to joints, to the very important energy levels, and it affects you. And just a few months ago, a patient sit in my chair and look at her mouth, and they're going through the medical history, and I just asked her a question: do you have any kidney problems? Do you have urinary tract infection? I said, no, I left it like this. 2 weeks later, she's coming back and bringing me a gift basket, telling Dr. Gashinsky, because of you, I went to my doctor and insisted to doing your test, and I found out I have a chronic urinary tract infection. This is interesting, that because we know every time we remove infected tooth, I ask patient, how do you feel? They talk, oh, no more pain. I'm not asking about pain. I'm asking, how do you feel? And start, oh, I have more energy. My digestive system works better. I can move my shoulders. And this is not the story. This is real what's going on to the patients. I have an amazing story that I cannot guarantee it. It just happens not to everyone. But I just recently removed 2 infected teeth from the young lady. She was on thyroid medication for many years, and she does not need thyroid medication anymore.
Wow.
It's not me, it's not miracle, it's her body. Because it's only one thing to stay on the way to thyroid function properly, those 2 infected teeth, nothing else. Usually patients have a multi-layer problems. And that every problem in the body is just adding up. And if you don't want to add it up, and that's why the time that we spend with the patient, they review medical history, how the digestive system works, and everything else, and looking at the teeth, and really asking questions, what do you feel about this organ, about this function, about this energy, about just being emotional? Then you see something with the teeth, you're always trying to figure out a connection. And if it's any connection, we're giving the patient an option how to deal with this.
Amazing.
Yes, it's amazing. It just really keep me going.
It's amazing to think that your teeth are attached to your body. I'm being a little silly, but
Your
I mean
smile
that
doesn't fit
story.
on the table.
Yeah, that story actually really blew my mind, honestly, because you hadn't told me that story seriously. Um, but there's such a disconnect that people, they don't realize that how it affects your whole system. And this is just one level of care that we offer our patients. Certainly, the traditional offices don't. They think they look at you like, you got three heads when you talk about this stuff, but you have story after story after story after how patients are helped by doing these assessments and paying attention to
Yeah,
the details, really looking at them as a whole, because that's what holistic means, right? That's the definition.
yeah,
It's
you're
the
right.
whole,
Whole
pieces of
body.
the whole together. So it's amazing how going to the dentist can not only just make your smile great, it can make your health fantastic. So for those of you who are on our webinar tonight and have been thinking about going to a holistic dentist, but you've been on the cusp, but you're not so sure, and you're like, I'm not so, we have an offer for you, webinar offer that, for $99, you can experience the full holistic treatment. We'll do a full comprehensive exam, like Dr. G was talking to you about. You'll check, certain teeth, check the meridian, other organs. He will check every tooth with the digital X-rays. We'll give you the supplements. Will you check everything with that carry view and make sure there's no decay that we are missing potentially with X-rays, and getting a full holistic cleaning with that ozonated water and those herbal solutions. We spend a lot of time with our patients to make sure we get them to that level of health, and we're offering that special to you tonight. If you give us a call at 973-379-9080, we'll be happy to offer that $99 special. That way you get to see what we're about. You get to experience everything that you've heard tonight. So with that, I want to ask our panelists if they have one last parting sentence so we can say goodnight. We're going to have questions on the chat.
See you soon, and just come here and experience what we're going to offer you.
Please come join us, our family, our team. We're wonderful here. Each individual here is very good, and we love our patients, and we want to do the best for you and give you the best. Thank you.
And I'm sure you're not going to be disappointed, and you're going to be very surprised of the difference that you're going to see when it comes to our treatments that we're offering to our patients, and you're going to compare it with what you've got in the best practices outside our office. You're going to see a huge difference.
Absolutely. And we do have a question about what we do use to polish the teeth with. And since we're not using any of the flavorings and the chemicals and the dyes, we're using just a pumice-based polish. Has no flavorings, has no colors, no dye, no fluoride, has nothing. It has a beautiful consistency, nice and smooth, that can remove any of the stain or any debris off the teeth, and without adding any additional stuff to your body. So basically, it's just a pumice-based, a fine pumice, with no added anything in it. So we use an herbal solution, herbal mouthwashes, has no alcohol. So, if you're looking for that nice minty fresh flavor afterwards, after we polish teeth, we happily give our patients a nice herbal mouthwash in the ozone water, so they can get a nice refreshing finish. I had one patient say, my gosh, it feels like I just was at a dental spa. I've had a spa for my mouth. It feels so good. It felt so great and cleaning. So that's the one question. So I want to thank all our panelists. Our next webinar is on Thursday, February 22nd. We are going to actually have a guest panelist that night. We're going to keep you in suspense for what the topic is, but I believe me, you're going to love it, and you're going to love this guy. If you know anything about our office, you've heard him before, and for those of you who haven't, you need to hear him. So mark your calendars, Thursday, February 22nd, again from 7 to 8. We're going to have a webinar, and more information to come. You'll get the emails, you'll get the Facebook notifications, so look forward to that sign up. So here's to you, here's to your health. and have a wonderful, wonderful night. Thank you all. God bless. Be well.
Thank you.